society you are, you don't have to force something that is against their values, but you have to try to preach it in a context that is acceptable to their culture. Adolescents don't really have a different access point here. Through the years of working, I got to really understand that labor pain is excruciating. Of course, in the Gambia, most people don't practice pain relief in labor. The awareness is not that much, even among healthcare personnel. Obviously, with pharmacological method, very few practice it. I try to educate people about non-pharmacological methods of pain relief. I am very happy when I see men come to labor. In fact, I encourage them to come and stand. With that, I guess they'll understand the need for spacing, the need for sexual and reproductive health.
So you also touched on pain relief for labor. What kind of pain relief would somebody expect to have when you come to your hospital when you're in labor? In the West, we see that they have gas on the air, they have epidural, they have a lot of other things that could help.
Oh, yeah, you're touching on a topic that I'm very passionate about. Because through the years of working, I got to really understand that labor pain is excruciating. And with maturity, I got to really understand that these women need help. Okay. Of course, in the Gambia, most people don't practice pain relief in labor. In fact, I did a research on pain relief in labor, the awareness and attitude of obstetric healthcare workers towards it. The results are not yet published, but it is really interesting to find out that the awareness is not that much, even among healthcare personnel. I mean, the different methods. What I looked at were the different methods of labor pain relief. The awareness of the different methods were not really high. Okay. So when you talk about pain relief in labor, you have both pharmacological and non-pharmacological methods. Obviously, with pharmacological methods in the Gambia here, very few practice it, and we have the resources to give it to every woman, number one. Number two, we're talking about health personnel. Do we have the numbers to be able to monitor all those women who are going to be on pharmacological pain relief? Let's say the opioids. Okay. Another issue, non-pharmacological is very easy to practice or teach, but how many of us are aware of them? And do we really educate our clients, okay, to let them know about these methods? Recently, this is something I noticed. With more years to come, I think I'll be in a better position to have a better understanding. But I try to educate people about non-pharmacological methods of pain relief. But you'll be very surprised that by the time they come into labor, it's as if they have forgotten everything you have taught them. I understand the pain, so I usually ask myself, is it that they don't take heed to the advice, or because of the pain they forget it, or is it that it has to take time for it to sink into the public? I go with the last option, which I think is a matter of time, that the more we continue to educate them, the more they will continue to understand and to sink in their head, and they will be practicing it.
Can you just tell us maybe one or two non-pharmacological
It's breathing exercises during labor. I'm sure if you have pain, the first thing you do is to sigh. And you think at least it sort of eases the pain, right? So breathing exercises, breathing, inhaling when the pain is there, and gently exhaling after the pain. Music, all right? Freedom to ambulate as you feel like. There are so many. Even being in warm water, having what we call a doula, someone who's going to be your partner there, giving you massage and stuff like that. But can you afford to have it in every labor ward in the Gambia, to accept every partner to be in the labor ward with the with the wife massaging the back, when even correct partitions we don't have? So it is a difficult task.
What do you have to say to men about these kind of issues where, you know, you wouldn't need a partner sometimes to be massaging you, to be helping you, but in the Gambia it's like men are not even allowed in the labor ward?
No, it's not right. They are making a mistake. I am very happy when I see men come to labor. In fact, I encourage them to come and stand, unless you tell me it's against your culture.
That's what I'm saying. You know, sometimes, you know, the attitude out there is, you know, you're not supposed to see women give birth.
Look, there are some cultures I understand, but not all. Okay, and when you see the guy comes into the maternity ward with the wife, it's a very big opportunity to make the guy appreciate the woman better.
Yes.
Okay, I encourage them to stand by the wife. I encourage them to be there during deliveries, and I've seen several reactions of men, which shows me that they have passion. They feel the pain of the woman, and with that, I guess they respect the woman more. With that, I guess they'll understand the need for spacing, the need for sexual and reproductive health. You know.
So sexual and reproductive health, it is a broad, you know, thing or topic that we cannot touch on.
We have not even talked about so many things about sexual and reproductive health.
Yes,
this is something that people study for 2 years. So to talk about it in 30 minutes is
yeah. So I would just like to come to the current situation, you know, which is the COVID-19, and how it may or may not affect people's services for pregnant women. You know, has it have you seen a decline or increase?
What we are currently doing is scaling down all over the world. We are scaling down, okay, only on essential services, emergencies. Notwithstanding, if somebody needs access to such, it is, you have the access. Okay, when you come, you are not going to spend a long time. Okay, what we are trying to stop is crowd gathering. Right? If someone needs continuity of whatever your family planning method you're using, obviously the doors are open. You come, you're not going to waste time here. We do whatever we need to do for you, and you go. Okay. If someone is coming for the first time, instead of what we'll try to do is to give you short-term methods for now that are applicable to you, obviously through explanation, counseling, and stuff like that, and then helping you to choose what method you think is more applicable to yourself, guiding you, I must say. So after that, you're free to have whatever you want to have, and then after this COVID, then we can.
So there's word out there that hospitals are testing vaccines to cure or prevent COVID-19 on patients, which has affected the demand for services. Have you seen any of that, or is that true?
I've not heard about it. This is another news. This is not the first time I'm hearing about it. But I think, as our minister rightly said, misinformation on this media is a problem. The government and the ministry is here to protect and provide services for its people. So I know that there is no way that people will be put at risk. Even in the West, they are trying to develop vaccines, let alone here in Gambia. I don't know when vaccine will reach us until we begin to try it. Okay, there has not been any proven vaccine that has been issued out as a vaccine that is fit to give people immunity from COVID-19. The only thing is that, from what I understand, people are working on developing these vaccines. So coming to a trial of these vaccines, for a vaccine to be tried, there's a lot of process. It must go through what we call ethical clearance, and ethical clearance, the government, the ministry, people are there to see, to say, yes, this is ethical for our people can have it, it's going to be safe, the safety of people are going to be guaranteed. So it's not just anything anyhow as people are thinking. And people they're not to make that mistake, to think that medications or vaccines are just allowed to be rolled in onto people. No, there is a process it goes through before it is allowed even to be tested. It is not yet available in the Gambia, let alone talking about testing it or trying it on people. Do you understand? So this is a misinformation that I advise people to cease from. Okay.
To start wrapping up, I would just like to know your thoughts on what you foresee the effect of COVID-19 to be on SRH, people's sexual and reproductive health in the Gambia.
We have been having a lockdown. One of the things I am foreseeing is an increase in pregnancy. Okay, the fertility rate will go up. I'm expecting that we will have something like 2 waves of peak seasons, because usually the peak season is during Hamatan, 9 months after that season. Now we're having people locked down. Okay, I'm expecting that we will have another wave after this, the first peak season. We'll have another wave of peak season again from the lockdown, because obviously if people are going to spend so much time at home and they are together, I guess the rate of intercourse is going to increase, and this might also lead to an increase in pregnancies. Right? Apart from that, people should not be afraid to seek for services. Okay, maybe also we'll be having issues of unsafe abortions and stuff like that, because people are not aware or they don't have the information of how to practice safe sex and stuff like that. So we might be having in the very near time some issues of unsafe abortion. But again, it goes back to what we have been discussing, giving them the information.
So I would like to take the opportunity to ask, we have different thoughts when it comes to not getting pregnant, because you have word out there saying that when you have sex and you stand up, the sperm comes out, you don't get pregnant, or you drink Coca-Cola, all these things keep on going on out there. Is it something that, is true?
It's interesting, taboos are always out there, but about pregnancy, pregnancy happens when a woman is in her what we call fertile days or ovulation period. Okay, so if you have any intercourse outside that area, and even when you're in ovulation period, it is not 100% that you're going to be pregnant. Okay, so about the positions and stuff like that, what is really important is for the semen or the sperm together to reach what we call the seminal pool, where it can have access to get into through the cervix to enter the uterus and then meet with the ovary there at the tubes for it to be fertilized. Okay, so about positions, whatever position you want to take, that is your choice. But again, what you need is to be able to have the sperm and semen together available in the seminal pool there behind, inside the vagina, so that it can swim and enter. Okay, and remember that the sperm is something that is mobile. It swims, right? So whatever position you take and the sperm can swim, it will swim and get in.
So finally, what do you think can be done to limit the possible effect of COVID-19 on SRH in the Gambia?
The effect of COVID-19 on SRH. COVID-19 is everywhere in the world. Obviously, I wouldn't say it's not affecting the sexual and reproductive health in some way. Okay, as I told you, sexual and reproductive health is just vast. So we are just talking about the sex issue. What about discrimination in women? The more they are at home, the abuses and stuff like that. You understand? How many crimes are reported? Okay, but the hospital is always open. Trust me. Hospital is always open. We say if there is need. If there is need, there's a difference between need and want. If there is need to visit the hospital, please do. But if you don't have the need to, just stay at home. It's for your safety, it's for my safety, and it's the safety of everybody around.
All right, so doctor, before you wrap up, I would just want you to talk about something very important. That is, like, in some societies, there are some women and girls that are forced to be virgins. Let's say after being like these FGM issues, like after being circumcised, then you're being sealed, just to force you to be virgin until when you get married. So there are some complications that occur when you get married also. But I just want you to give advice, because I see some people still do it, and there are still some ladies out there that are going through things like this.
According to the law of the Gambia, FGM has been banned. So it's for the authorities to enforce that ban. Okay, and for people to also sort of like overcome fears of forgetting practices that are not beneficial to a woman. Okay, if you have a culture, if you have a belief, to take that thing away from society just like that is not very simple. So it will demand more education, to demand more counseling. Okay, FGM, we know the complications for women during labor. Okay, even for their sexuality. Excuse me to say. All right. About the sealing, it is one of the means of stopping a woman from being sexually active before marriage. But I think it is also infringing on the right of somebody, because if somebody is going to be 20 something and still has that sealing, and the person decides to be sexually active and she can't have access to it because something was done, it is really infringing on the right of the person. But, so it goes again to what we have been saying. We need to educate our society, need to educate people about the dangers of these things. And I guess with time, we will overcome it. Because presently, I get the numbers are going down. Yeah, so I guess with time, we will get there.
Thank you very much for your time. It has been an interesting one.
Yes.